today here in studio we have Cecilia, who is going to be taking us through the same. She's going to be talking to us about back pain. And thank you so much. Karibu sana. Naomba tu ukiangalia ile kamera, you introduce yourself to us, nusalimie watazamaji wetu.
Okay, good evening. My name is Cecilia Mwaniki. I work at Mwai Kibaki Level 6 Hospital in Orthopedic and Trauma Department. I'm happy to be here this evening so that we can go through the back pain, which is a big challenge in so many people around this area. Thank you.
Yeah, asante sana. We are also so much happy to have you here. And according to statistics, over 75% of people working in offices complain about back pain, and over 90% of those working in hospitals like yourself are also affected by this. What is back pain and why is it so common?
Okay, back pain is any pain that you feel between the neck, your neck and the down. Where, like, you are from where the sitting position, from the any pain that happens between the back, we call it cervical pain, up to pahali hapa pahali unaketia. So any pain happening there is what we call back pain. Back pain is brought about by so many things, which we are going to see today. But first of all, when a patient comes to us, we have to look at, like, for how long has the patient had the back pain for us to be able to treat them. So you have three types of back pains. You have the acute. Acute is the pain that has lasted for less than 4 weeks. So if a patient comes to you with back pain and this back pain is less than 4 weeks, that is an acute back pain. And acute back pain is treatable with medicine and physical therapy. Then you have subacute. Subacute is the pain lasting from up to 12 weeks. Any pain that between 4 weeks and to 12 weeks, that is what we call subacute pain. Then we have the chronic pain. There are patients who comes to you, they tell you that they've had back pain for 12 weeks, over 12 weeks to 3 months, 2 years. We call it chronic, which is also a bit challenging when it comes to treating it. It is also treatable. There are things that we do to treat it. Yes.
Thank you so much. So you've also mentioned that we have different parts of the back. Like you're saying, it's all the way from the neck to the lower, just right before our bottoms, if I could say that. And are these pains all affecting the same parts, or sometimes you could have pain that is affecting a different part? Or what exactly is happening in our backs by the time we are saying, I have back pain?
Okay. It depends with the cause of the back pain. Like the pain happening around the neck, it depends with, like, it happens in so many people who work in offices, depending with the posture. Sometimes can be caused by the injuries. Kuna pain yenye na happen kwa the lower back. It is caused by whatever we do. Most of the time what we do, arthritis, diseases, depends. Yes. But the back pain can happen anywhere. But it is most common around the neck and the lower back. Yes.
Now let's go into details about the causes. Ni nini nasababisha hii uchungu? Like, for instance, umetaja arthritis.
Yes.
So how is arthritis causing the back pain?
Arthritis, like, if I can describe arthritis, is any diseases that affect the joint. Like, for example, we have the spinal vertebrae. Yeah, maybe I can explain.
You could stand and
yes.
use the diagram.
So let's use this diagram to show the different types of pain and the causes. So we have this is a vertebrae. These are the spinal bones. We have these vertebrae. Then between the vertebrae we have the shock absorber, which is the disc. And I've seen so many patients confusing between the disc and the vertebrae. So here we have the vertebrae and the vertebrae, and between the vertebrae we have the discs. Kazi ya disc tunasema ni kucushion, kuzuia the disc kugwaruzana. So kwa hii disc kuna water among other things. So hiyo inawa kama shock absorber. So here we have the degenerative disc. Okay, compare this and this, unaona hii imeanza like kujifinya kidogo. So this is the arthritis setting in. We have the bulging disc. here sometimes this hii disc inakuwa pressed, inafinya na huku nyuma. So that is the bulging disc. Some other times inafinya kabisa hadi like inatoka, ina herniate. Like vile tunakuwa na umbilical hernias zinatoka nje. So this one ina herniate, inafinya inatoka nje. So we have this one. Hii imekuliwa na arthritis kabisa. So okay, ikifika hapa unaweza pata the bones zimeanza kukulana na zimefinya the disc of which inaleta shida. Then we have disc degenerative with osteophytes. Okay, hii ni arthritis with osteophytes, ni zinakuanga sharps. Ukipiga x-ray tunazionanga Then kwa hii vertebral column we have hii space. This is where the nerves zinapitia. Hapa katikati ni kama mfereji. So anytime we have a problem, the problem ya disc huwa inafinya the nerves. Na ikifinya nerve ndio inaleta pain. Nerve ndizo huwa zinatupatia nguvu na ndizo zinatucontrol, like ndio maana unaonanga mtu akigongwa mgongo anaweza kuwa disabled because nerves ndizo zinatupatia nguvu kwa mwili. Yes.
Thank you so much. That is quite a very simple way of what is happening when we are having back pains. So it could be either of what Dr. has explained, but among the causes we hear that a sitting position, sleeping position,
yes,
among other things. What are some of the other causes that would make this happen?
Okay. So other causes are like, okay, even these ones can be caused by whatever I'm going to explain, like occupation. We have seen like most nurses are affected by they get back pain. This is because of they huwa wanabeba sana. That act of carrying patients hiyo inawafanya wapate the back pain. Ina affect mgongo, wana strain mgongo. Then we have the office workers, the sitting position. Mtu anakaa for a very long time, like ameinama kwa computer the whole day, ana strain mgongo without kujua. Then tuko na vitu kama pregnancy. Mgongo inafaa kukaa kama S generally. Kama tungekuwa na picture hapa tungeona mgongo inakaa kama S. So anytime you are pregnant, the pregnancy huwa ina tend kupull mbele. So ina strain mgongo pia. You can get back pain. Kuna other diseases like for example tumors, bone tumors. Kikuwa na tumor kwa mgongo itafanya upate back pain. Ita press the nerves na utapata back pains. Then we have other diseases like TB, infections. Kuna infections huwa zina move, zinatengeneza pus, zinaenda kukula is the bones na zinaleta back pains. Yes.
Thank you so much for that. You mentioned that nurses, mostly it's going to be associated with the occupation that wanapendua wagonjwa, wanawainua at some point. Does it mean that lifting heavy objects is going to...
Yes.
And what is the line between exercise? Kuna watu wata exercise and inaweza strain mgongo, and then pia kuna the work kama mtu anafanya kwa mjengo. Are they predisposed to maybe having back pains?
Yes. Exercising. Unajua when you're exercising, there is how you're supposed to exercise. So kama unaenda gym, the person mwenye ana control the gym will be able to show you how to, like kama ni kusimama, kuna there is how you are supposed to weka miguu zako ndio strain the back. There is how you are supposed to put your back for it to be safe. But now when you're lifting heavy objects from down, kama mawe, haukwangi umeweka mgongo hivyo. So unaenda up ku strain the back. Ku bend for a very long time. Inaleta mashida za mgongo sana. Yes.
Do we have other risk factors, things that will increase one's chances of suffering from back pains?
Yes. Like smoking. The smokers, the drunkards. Yes. This smoking affect the immune system. Like you affect the immune system, you end up getting the back pain and other diseases. In fact, there's someone who once said, smoking causes all the diseases apart from pregnancy. Do you know? Unajua, like watu wanasemanga alcohol can cause pregnancy. Through labda hivyo sikuwa najua, I was not myself. But smoking causes all the known diseases. Yes, so smoking. Then we have other things like obesity. Kuwa mkubwa sana, such things. Lifestyles, kuna watu wenye wapendi like anataka kushinda kama ameketi chini, kutoka hapo ingia kwa gari, no exercise. Such things will predispose you from arthritis. Kuna arthritis there are so many types of arthritis. So there is this one yenye inakuanga kwa blood, hiyo unazaliwa nayo. So that one itakupredispose. Yes.
And do you have any relation whatsoever between back pain and some mental health issues?
Yes. Like depression. When someone is depressed, there's a hormone that is released that lowers the immune system. So when the immune system is lowered, the ability to heal the, like, just in case you have strained your back, so the ability to heal inaenda chini. Then again, when you are depressed, most of the time you don't exercise, unashinda umekaa pale pamoja. So that one will, na tumesema kuketi sana for a very long, bending for a very long, inakuletea ina strain na ina sprain mgongo. So inakuletea back pain. Yes.
Thank you so much. And when we talk about treatment, you're going to be talking about how should we sit, because nimesikia umetaja venye mtu anaketi and also kulala. We're going to talk about how which is the correct way to sit and even sleep. But right now let's talk about symptoms. Juu umetaja kuna mtu atakuja with acute acute back pain, amekaa like 4 weeks, mwingine akuja up to 12 weeks, and someone else will even come like after an year, sema nimekuwa nikiumwa na mgongo for 1 year. So what are the symptoms zenye ukisikia kwa mwili yako you should visit a hospital?
Okay. Tumesema back pain inaletwa na anything that can affect the nerves. Nerves tumesema zinapita kwa spinal cord. So when you have the, like, sometimes there are patients wanakuwa affected, anakuja kwa anasema ana feel pain around the hizi nyama za nyuma, the buttocks. Nyama pain iko kwa nyama, haiko kwa joint. That one iko associated with numbness, muscle spasms. Muscle spasms ni muscle pulls, weakness, such things. Za kuonyesha there is a nerve that is compressed somewhere. Yes. Some other patients wanakuwa na difficulty in urinating. Anasikia kwenda haja ndogo lakini hawezi enda, anashindwa kupush. Because tumesema nerve inapea nguvu. Now if the nerve is affected, inamsaidia na mambo na urinate, that patient will be able to push the urine outside. Yes.
And there are chances that someone with back pain, when they rest, mostly when we rest, unafai ku feel some relief, ni kama umepumzika. Mtakuwa na back pain, is it possible that when they rest sikia uchungu or something?
Yes. Ina depend. That one also depends. Like, for example, resting, umerestaji. You're supposed, there's how you're supposed, your back is supposed to kukae. So ukirest, rest in bad position, definitely utakuwa una sprain ama una strain your mgongo wako. But kuna kurest, there's how you can rest na rest in a good position. That one might relieve. Then sometimes wanatumia the cold packs na hot packs. All those was na relieve the back pain. Yes, at home.
And are there chances that back pain would resort to other complications, like for instance problems with urinating or something like that? Could back pain resort to any other complication if left untreated?
Yes. Let's say, for example, a patient sustains a fracture around the neck. The nerves that supply the heart and the lungs, the lungs zinatoka kwa neck. So anytime patient amekuwa affected hapa na amekosa kuwa treated vizuri, it will affect that patient's breathing. That can even lead to death. That's why in case of an accident and you have to like transport that patient to the hospital, in case you have very severe back injury, you're supposed to call an ambulance, because back injury can lead to death. Yes. So urinating, if the nerves that control the bladder are affected, you'll definitely not be able to push the urine outside. Yes.
And could it lead to weight loss in any chances? There are chances that back pain would lead to weight loss that you did not intend?
Any back pain that leads to weight loss, that one is associated with something else, like tuberculosis, infections like TB. I remember telling you, some of the infections can move down to the back, na zina settle up na zinatengeneza infection at the back. So any infection kama TB huwa inakuja sometimes, kuna kuwa na TB spine. So that's when a patient would lose weight, not because of the back pain, but because of the other condition. Yes.
Which explains that someone should not assume they have back pain juu wamechoka. Maybe it's even some other underlying condition.
Yes.
So they should come get checked. So another instance of back pain is in women, that when they have their menstrual periods, they experience back pain. Some of them, a lot of them complain that they have back pains during that period.
Okay.
Why is that?
Any structure located around the back. Okay, if any of the structures located around the back is interfered with or affected, it will lead to back pain. Like for example, if you have the kidney infection, maybe your kidney swells, it inflame, it will push the back, definitely, and you get back pain. When those young girls are in their periods, these are periods who has form clots. The clots themselves cause back pain. Yes.
So it's the cramps that someone is experiencing that will be causing the back pain.
Yes.
So should they take medicine for that? Because to imagine it's only for that period, or what should they do?
Okay, sometimes it is so severe that you have to take some pain meds, but even warm water, hot water, huwa ina work vizuri sana na hiyo. Yes. Hata kuwekelea tu kitu moto.
The stomach, not at the back.
At the stomach. Ina resolve the clots.
Thank you so much for that. So is back pain more common in men or in women, or there isn't a gender factor for back pain?
Back pain is more common in women. And this is because of the kazi zenye mama wanafanya mara nyingi ni kuinamilia sana. Weight, childbirth, all those ndizo zinafanya mama wakue ndio wanapata back pain more than men. Yes. And most of the kazi men wanafanya nyingi, apart from hizo umeongelea labda za mijengo, kulift heavy things, men wanakuwa na kazi zao nyingi zinakanga ni kama ku-exercise. Apart from maybe the drivers when you wana drive for a very long time, because hata wana experience sana back pain. Kazi nyingi za wanaume zinakuwa haziwezi cause back pain kama za mostly ni occupation na labda your weight for women.
Now, are there chances that tutapata mtoto akona back pain? Because first of all, is age a factor that maybe watu wazendo wataumwa sana na mgongo?
Yes.
Wazendo wataumwa sana.
Wazee, age from 30 years and above, hao ndio juu ya kazi, occupation, hao ndio wako prone to accidents. Sana ni occupation na prone to accident. Then even arthritis ina develop as you grow old. Na arthritis is one major cause of back pain. Yes.
So mtoto anaweza kuwa na back pain?
Yes, wanapatanga because there are conditions that watoto wanazaliwa nazo, kama there is what we call scoliosis, lordosis, kyphosis. Scoliosis ni mgongo inakuwa imebend like an S shape, ina bend outward. So such conditions zinaleta back pain. But at least those ones are treatable wakikuja hospitali mapema. Yes. Wanatumia prosthesis, but maybe we shall talk about that when it comes to
when we talk about treatment. So for now, let's talk about diagnosis, because someone will sit at home and think my back aches because nafanya kazi ya kulima, nimeinama sana, or if it's a lady, they'll think it's from childbirth, like you are saying. So that is sort of self-diagnosis. We may assume itakuja na itapita, but there has to be a way that back pain is diagnosed by the professionals and how it is treated thereafter. So how is it diagnosed?
Okay, first of all, it is very wrong to ignore, because as ukikuja mapema, the earlier you come, the better ndio utakuwa treated vizuri. So diagnosis, patient akikuja kwetu, the first thing we do is an x-ray. After taking the history, we do an x-ray. An x-ray will show you most of the time tunapatanga patient mgongo ime change the shape, the S shape we talked about. So that way we are able to know whether maybe tutamtuma the treatment. So akikuja with weight loss, fever, that one you have to send, lazima tumtume lab tuone kama kuna infection. Yes. Ikikuwa severe sana, after kupiga x-ray tuone like this is too severe, maybe to suspect some things like infection, tumors, we send them for MRIs. MRI is able to detect na kuoneshana vizuri. Yes.
It's more clear than the X-ray.
Because it's able to, inaonanga hadi nerves na the soft tissues. Yes.
And then you can establish the problem, which now takes us to treatment, which you're going to be discussing after this short break. Don't go far. We will be back.
Okay.
The Aberdare Technical College ATC ni marakumenyithia ati Intex ni irathie na mbere ukegwatira artisan certificate kana diploma kothi neici tau thiini wa School of Hospitality urathomera kothi ta Food and Beverages Production and Service, Catering and Accommodation Operations na Baking and Pastry Skills. Thiini wa School of Hairdressing and Beauty urathomera Hairdressing and Beauty Therapy na Barbering and Massage. School of Media Technology ugathomera Photography and Videography, Corporate Live Streaming na Drone Operation Skills. School of Electrical Engineering ugathomera Electrical Installation na Solar PV Installation. School of Water Engineering Technology ugathomera Water Engineering Technology na Plumbing and Water Services. School of ICT ugathomera Diploma in Information Technology, International Driving License neo ICDL, Computer Repairs and Maintenance na Computer Packages. Kwina hostels na no maragwethera attachment mari mita 300 kuma Karati na tauni, farafaraini ya Karati na guthie Nairobi, na no mahurire thimu namba 0726 507444. The Aberdare Technical College ATC, turning learners to entrepreneurs.
Dunamis International Gospel Center presents Nairobi, Kenya Healing and Deliverance Crusade. Theme: The Day of His Power. Ministering live, Dr. Pastor Paul and Dr. Mrs. Becky Paul Enenche. Date: 16th to 17th of May 2024. Time: 5 p.m. daily. Venue: Kasarani Stadium, Nairobi. Come and experience salvation, healing, deliverance, miracles, signs, wonders, and the almightiness of God's power. Special feature includes Ministers Conference holding on Thursday the 16th and Friday the 17th of May 2024. Time: 9 a.m. For inquiries, call +254 7586 55045 or call +254 7577 66261. Invite everyone.
Thank you so much for keeping it GTN TV, the home of gifts and talents. This is Medicamp. In case you're just joining us, today we are talking about back pain, which we've seen that it's a common condition among men and women, and a lot of people are suffering from it. We've talked about what brings it about. We've talked about how to diagnose it. So you should not sit at home and say that I'm suffering from back pain. A doctor should confirm that. So now we are going to be talking about treatment. How do we treat back pain?
Okay. The treatment is based on how long this back pain has been there. We also base it on the cause of the back pain. For example, if a patient comes with, for example, spinal injury, the fracture, such things, that one you have to treat it, to rest you have to rest it. Sometimes the patient has to be taken to theater. So that is the surgical treatment. Then there is the patient who comes to you with an acute pain. We talked of 1 to 4 weeks, between 1 to 4 weeks, 1 day to 4 weeks. So that one is treated with medication. You give them medicine. Sometimes you send them to physiotherapy according to the X-ray. The other one, the subacute, you have to send them for MRI, That one, for those patients, we have to send them to physiotherapy. Physiotherapy is a key thing in treatment of back pains. Then there's that surgical part for those patients with maybe fractures. There are those ones with herniated disc, whereby this disc has to be, the spine has to be stabilized. So that one, those patients are supposed to be sent to the spine surgeons or the neurosurgeons. Those ones, they were supposed to, that's how they stabilize the back. Yes. Yeah.
Thank you so much. So my producer is saying you've said physiotherapy a lot of times, but hajaelewa hiyo ni
physiotherapy ni daktari ambaye anatibu through kufanya exercise, mazoezi, kukanda mgongo na kufanya exercise. Na wanafanya kazi nzuri when it comes to back pain, because they are also able to explain to you what you're supposed to do to prevent the back pain. Yes, and the exercises you're supposed to do at home. So kazi ya physiotherapist ni mambo na exercise kabisa.
Thank you so much. And you've mentioned that there are some exercises that you're supposed to be doing. If maybe you could just break down that to our viewers to help deal with the back pains just back at home. Someone is having back pain.
Okay. First of all, you're supposed to. I think we are supposed to look at the preventive measures. Like now, the chairs we sit on at home. Zingine zimekaa mgongo iko straight. Like when the sitting positions. Wakati kiti yenye unakalia, unafaa kuangalia ku make sure that mgongo wako at least ina remain kama S shape yenye tuliongelelea. Then kitanda unalalia, unafaa kutumia mattress higher density. Then avoid lifting things nzito kutoka chini. Most especially the moment umeanza kupata back pain, you're supposed to avoid hizo vitu za kuinamilia, kulift vitu kutoka chini, kubeba vitu ngumu na mgongo. Yes, such things zitakusaidia kumaliza back pain, kumaliza na kuzuia kuendelea zaidi. Yes.
Thank you so much for that. And are there certain sleeping positions that you happen to mention that mtu akilala, there is a certain resting position yenye mtu anaweza lala nayo, and then it's going to cause them back pain. So is there a certain way that we should sleep to make sure that our backs remain sorry about that, our backs remain in the S shape and that we're not going to experience back pains?
As long as you have the proper mattress, uko na proper mattress na pillow ifai kuwa haya. Unafaa kutumia pillow kidogo sana juu ya shingo. You can sleep in any position na hauna back pain. You can sleep in any position. Yes.
Kwa hivyo pillow isikue,
pillow kubwa sana ina cause back pain. Na pia hufai kulala flat sana. So you are supposed to have a small pillow around the neck. Yes.
Thank you so much for that. Any other preventive tips like I know some of those that should be so obvious, like if we said that smoking could lead to back pain, then maybe someone should quit smoking. So are there any other tips that things that have to do with our daily experiences? Because from this talk we can see that back pains comes a lot with what we do every day.
Yes, yes. Let's talk about maybe the typicals. Hakuna haja ya kubeba like kikapu kubwa. At least if you're able to, kama unaweza chuna hiyo majani kionolia somewhere else, that one itakusaidia, itakuprevent from getting those back pains. Then bending, like for ladies wakati unafua nguo zako, avoid bending. By the way, avoid bending. That one itakusaidia sana. At least wekelea hizo nguo pahali, uzifue kama umeziekelea pahali. Kubeba hizo vitu mzito na nini. Then walking is a good exercise. Yes, to avoid like kama nika distance kadogo 1 kilometer 2 kilometer tembea. That one itakusave back pain from.
And for people who are experiencing back pain because maybe they are pregnant, how soon should it disappear after they have their babies?
It depends with everyone. That one depends with everyone. Kuna wenye immediately after giving birth disappears. Kuna wengine inachukua muda, sometimes hata hitaji treatment, just goes yenyewe, kuna mwili yenyewe ndio inaenda ikijirudisha normally vile ilikuwa. So ingine inachukua muda, depends with kila mtu. Yes.
At what point yenye ikifika na bado haijaisha, that person should visit a hospital?
I don't think it should go for more than a month na bado unangoja ipone. It's good to go to the hospital. They see kama watakupea, sometimes inaleta muscle pulse. Muscle pulse hizo ndio zinafanya umwe na mgongo sana. So at least utakuwa able kupewa dawa za kuzuia hizo muscle pulse. Yes, so it is not good. Ikipita 1 month, ikitoka from acute to subacute, it is good to visit the doctor. Yes.
Yes, thank you so much for that. And when it comes to exercises, at some point you mentioned that watu wenye wako gym, when they're lifting those heavy objects, there is supervision. They are being guided. This is how you should maybe stand. And so would you discourage people who, like I see back in the village, utapata mtu vijana ameka cement na kaeka mti pale. Do you think that is dangerous? Because I don't know if there is someone to tell them that that's a good weight.
You see, mgongo iko katikati so the center of gravity inakuanga katikati. So anytime you are lifting kitu from this side, na hii side labda the weight iko less, utakuwa una affect, una overwork, una sprain, ama una strain this side. So that one will cause the back pain. So there is how, kuna vile wana balance. If they are able to, kama wanajua hivyo ni sawa, there is how you balance, unaweka miguu so that una your center of gravity isirudi one side, ikuwe tu at the center. So that way you can lift anything you want to lift na mikono yako. Yes.
Thank you so much for that. We also talked about back pain in small children, and you showed us that there is how it's corrected. How is that done?
There are braces wanatengenezewa, ama we call them corset. So kuna vile zinatengenezwa, zinajaribu ku correct the back. So they keep adjusting it as they push the back vile inafaa kukaa. Yes. Braces are also worn by arthritis. Kuna wenye wanavaa the corset belts. Wakati labda umepata hiyo the arthritis imecause the scoliosis pia. Tumesema kuna scoliosis inakosiwa na arthritis na kuna yenye inakosiwa na kuna yenye iko idiopathic. Idiopathic ni kusema haijulikani inafanyika kwa nini. Mtoto anazaliwa tu nayo. So hiyo ingine pia wanavaa the corsets. They try to correct, kuna vile zimetengenezwa zina try to correct the back to back to normal. Yes.
In case mama is asking wangu amevaa corset na bado hajarudi, how long should that happen, or it depends on that particular child in that particular condition?
For the children ama for
the children especially.
Tumesema you are supposed to keep adjusting it. So kuna watu wanaitwa orthopedic technologists. Wanapima mtoto size yake, anatengenezwa the corset, then they keep adjusting it as anaendelea, wana review kama kuna any improvement. So inaenda up to from 3 to 6 months. Yes.
And the child should be okay. And for those who are grown-ups, is it something they have to wear like for life, ama ni just for a while?
It's for a while. Yes. Ikikuwa like, unajua our bodies, for example like the corset belts, hizo zinakuwa worn by the shoshos with arthritis. Ukivaa for long, this how our bodies was zinazoea. So inakuwa the muscles are weak around there. Zina weekend, zinataka tu zishikiliwe na the corset. So actually we don't, kwa hizo corsets hatu advise mtu avae more than 3 months. Ikikuwa hapo unakuwa dependent, which is wrong. Then for the young people, if it doesn't resolve, that's when nani ana come in, the surgeon comes in. I think there's how they can correct surgically. Yes. Otherwise we haufai compare for a very long time. Your story ya dependency. Yes.
Isikuwe ni kama they have to live with it.
You weaken the muscles around there.
And surgery will correct it for good. Like when it comes to someone has to go through surgery for back pain, that is the, what do we say? It's like the last line of intervention, such that after that you're just going to be okay.
Yeah, you're supposed to be okay.
Yeah, if it is successful.
Yes.
Yes, thank you so much. I think you've quite educated us on back pain, and I think everyone knows what exactly to do so that maybe we can prevent back pain to the extent that we can. So unless you have something more to add, maybe something that you feel it umeacha na itasaidia someone out there.
Okay. Any back pain that is caused by injury, trauma, labda mtu ameanguka from juu, not even back pain peke yake, ama kama kugongwa hata mguu. I've seen people, watu wako na tendency ya kutumia maji moto na chumvi. I've never understood why they use salt, because I understand mwili inafaa kuwa ikitoa chumvi when we sweat. So wanatumia maji moto na chumvi. Anytime there is injury, there is how your body immune system respond by kusupply damu nyingi hapo. So when you add maji moto na everything, you worsen. So you are not supposed to use hot water na chumvi. Kindly wacha watu waende hospitali or get the best advice from the doctor. Yes.
I think that is the little icing on the cake, because I think that is the intervention everybody knows back at home. Mgongo wangu inauma, nikande na maji moto, and now we know that it's wrong. Also I think people will buy some. But
now for the mgongo kuuma, mgongo ikiuma, the nerves, nerves ukiekelea the hot maji kitu moto, huwa inasaidia. Kama sio injury ya kugongwa, trauma, ukiekelea huwa inasaidia. Juu tumesema inasaidia blood supply. So you can use your warm bath ama the cold ice packs. Hizo zinasaidia sana ku relieve the back pain. Yes. Hiyo yenye haijakuwa caused na injury. Labda kama umefanya kazi for long, kainamilia for long, ukaenda kuinamka ukasikia mgongo. You can use the hot water and the cold packs. Hizo zitasaidia ku relieve. Sometimes they help to relieve the pain. Yes.
And there are some sprays that also people use, or what do we call them? Something that they apply kama mtu akona. Is that recommendable? Should someone buy that over the counter, or should they be advised by a physician?
Hizo sprays zinakuanga dawa. Ni painkillers in form of a spray. So it's good to seek the medical advice first before you use any medication. Yes.
Yeah, thank you so much for that. We really appreciate you taking your time to talk to us about back pain. And I think you've quite learned, just like I have. And yeah, that's why we're going to be wrapping it up until next Tuesday, same place, same time. Stay safe and remember that your health is your wealth, and make sure that everything that you do is going to add to your health, or it's going to impact your health positively. Bye until next time.